What are shoulder diseases? Diseases occurring in the shoulder and joints. Shoulder arthrosis, shoulder calcification. Rotator cuff. Tears. Shoulder dislocation base. Arm, proximal humerus. Fractures. Acromioclavicular joint arthrosis. Frozen shoulder. Impingement syndrome. It can be listed as calcific tendinitis.
It is the wear of the cartilage covering the joint surfaces in the shoulder. Pain occurs in the joint, limitation of movement and weakness are observed. When trying to move the shoulder, it gets stuck. Diagnosis of the disease is made by physical examination and X-ray. If calcification is advanced, surgical treatment is preferred. During the operation, calcified joints are removed and artificial joint prostheses are placed. The patient regains his/her health in a short time. There are 4 tendons that move the shoulder. These tendons are called rotator cuffs. The shoulder moves in different directions with the help of the rotator cuffs. In cases where tendons rupture as a result of wear or trauma, pain and subsequent calcification may occur in the shoulder joint. When the rotator cuff tears, pain develops from the shoulder to the arm. Cases of shoulder dislocation are frequently encountered in the shoulder, which is one of the most mobile joints of the body. It mostly occurs due to trauma. If shoulder dislocations occur before the age of 20, the risk of recurrence increases. The risk decreases with advancing age. During shoulder dislocation, the patient has difficulty moving his arm up. It develops due to trauma such as upper arm fractures, falls, traffic accidents, and gunshot wounds. Its incidence among all body fractures is 5%. In cases of shoulder fracture, the patient has difficulty moving his arm and shoulder and suffers extreme pain. In these cases where urgent intervention is required, the degree of fracture and the amount of fragmentation and separation are determined by physical examination and radiological examinations. It is a disease that occurs with calcification of the joint between the shoulder blades and shoulder blades. This disease, which is seen in older ages, reduces the quality of life by increasing mobility limitation in later stages. In the treatment of the disease, the first aim is to reduce pain. For this purpose, painkillers and anti-edema drugs are used. The shoulder is rested with a sling, or cortisone is injected into the joint. It is a condition in which the capsule and soft tissues of the shoulder joint harden for an unknown reason and cause movement limitation. It is seen in 5% of the population and mostly in women between the ages of 40–60. The patient has difficulty lifting his arm, cannot comb his hair, cannot lie on his arm at night, and has difficulty picking up something from a height. In treatment is tailored to the cause of the disease. It is one of the most common disorders in the shoulder. This disease is a disease of poor and overuse of the shoulder. It occurs when the muscles, tendons, and sac that allow us to lift the arm get stuck between the bones that make up the shoulder. It is mostly seen in swimming and volleyball athletes and housewives. If the necessary treatment is not given, entire tendons may rupture. Calcific tendinitis is a condition of inflammation and irritation of the fibrous tissue called tendon. It is often seen on the shoulders, wrists and ankles, knees and elbows. Inflammatory and destructive processes that occur after excessive and repetitive exertion are effective in tendinitis formation. Sometimes calcium accumulates where the tendon attaches to the bone, and this accumulation can also be seen on X-ray. Acoustic tendinitis indicates long-term chronic damage to the shoulder. What are the most common causes of shoulder pain? Winter tears and injuries, fractures and dislocations, cervical disc, hernias, calcifications, bursitis and tendinitis, nerve compression, liver and gallbladder diseases, lung tumors and inflammations, rheumatic diseases, frozen shoulder diseases. What causes shoulder diseases? The most mobile joint in the body is the shoulder joint. Therefore, shoulder discomfort is frequently observed, especially heavy loads on the shoulders, home and professional work where overhead movements are frequently performed, and throwing movements from top to bottom cause excessive stress around the shoulders and in the mechanisms that support the shoulders.
Injuries that may occur on the shoulders may occur due to reasons such as traffic accidents, falls, sports injuries, or after repeated excessive movements and wrong movements. Shoulder diseases are frequently encountered in young people, workers, the elderly, and those who do sports. Diseases of shoulder and surrounding joints. The arm, shoulder blade, and shoulder blade form the shoulder girdle. These bones are connected to each other for free movement of the arm. Muscles, tendons, and ligaments connect the shoulder bones to each other.